Good morning, Dr. Sampada.
Good morning.
Congratulations on making it your
Thank you
dream
so
course.
much. Thank you so much.
So tell us a little about yourself, where you're from, how did your journey in medicine begin, and what you have done so far.
Sir, I am from Aurangabad, Maharashtra, Chhatrapati Sambhaji Nagar, now known as. I did my MBBS and MS both from Grand Medical College and Sir JJ Group of Hospitals, Mumbai. I
Mhm.
graduated MS last year in 2023, and after that, I have been working as a senior resident in the Government Medical College, Kolhapur, for like last 1 year.
Great, great. So how was your exposure or interest in oncology? How did it get stimulated? Um, many people have some story behind that.
So during the 3 years of my residency at Grand Medical College, we used to get exposed to a lot of oncosurgical cases, like breast, thyroid, colon. But some of them were not able to be managed at our level due to not having a oncosurgical setup or chemo radiation. We had to send patients to Tata. So
Okay.
that time I was very curious about like what happened to that patient. They like sometimes they used to not follow up, and found myself more driven towards these cases, the preoperative planning, intraoperative margins, and taking more care while doing the surgery and postoperative their follow. Also, I came across like interesting cases. Like in first year itself, there was a case of Gardner syndrome and some bilateral phyllodes and androgen insensitivity, complete androgen insensitivity female. So that was very intriguing. Like I had to do research, and we used to publish papers regarding it. So that was very stimulating for me, and I found myself taking more interest in such cases. So by the end of my third year, I was pretty sure that this is what I want to do further.
Great, Sampada. So you've already, been through the mill, I would say, because, half of the things that you're talking about is what we routinely do in oncosurgery, like, preoperative workup, planning, postoperative adjuvant therapy. These are the things that, really make a difference. We realize that, oncosurgery is a multidisciplinary field in many ways. Oncology is not just about doing the surgery. That is the major difference, I think, between, surgical oncology and other fields, because we have to integrate a lot more with our colleagues in other fields so that we give the best results for the patient. So, how did you go about your preparation? Since you already got in last year, so you knew the basics and how it is going to be. But this year, any specific things you did to make sure that you were in the top 10 rank so that you are able to get the seat of your choice?
Sir, I always wanted to do oncosurgery specialty from a central institute. So I had actually been I had actually started my preparation last year after I finished my MS exam. I actually did not give NEET SS because I wanted to focus more on this. So last year I did not give any NEET SS, and last year November I got a rank AML of 32, and that was just in a preparation of like 2 months. So that time I was getting aims Rishikesh, so I was like, let's not settle here in just 2 months. If I am able to reach here, I might get better seat next year. So I did not take up that, but I surely understood that what all is required for it. So apart from details of the oncosurgery, we also have to focus on general surgery too. In first attempt I did more of oncosurgery as I was fresh with the general surgery, so I went by. In the next last May exam, April May exam, I got a rank of 16, and there were only 10 seats. So I just missed it by some points of marks. But like I spoke with you in the last interview, I knew that I was on the right track. I just needed a little bit of dedicated study. As I was working as a senior resident, I used to get a time to study. The department was very helpful, but still I used to be more concerned about like what is happening in the ward, what is the planned OT, how is the patient. So my mind used to be occupied somewhere there, and then I decided to take a break of like 2 months before the exam so that I will be solely focusing, and this was a very precious attempt for me. So I thought I will just dedicatedly prepare for it. And also, right, I have been reading details of oncosurgery from your notes and videos from last 1 year. So I, at this point, I had become more well versed with that and started to like get the feel of general surgery a little less. So I focused more on general surgery this time. That is the what different thing I did, and it really helped me, sir. Your videos, MCQs, and everything, it helped me. So I think balancing both oncosurgery and general surgery is very important, and that's what I want to tell everyone.
That's great information. I know a couple of points there that I would have to stress for the people who are listening to this. So one thing is like, uh, yeah, I know there are a couple of people who say that you can keep working and keep studying, but yes, you keep doing that. But towards the end, the last 1 or 2 months, I think it's better to take some time off and focus wholeheartedly on preparing for the exams. Just giving that final push, like any other major exam, we give the exam its due and take a couple of months off and study. That is one point that many of our toppers are telling. And the second one is like, how doc tutorials, videos, and notes have helped. And consistently keep doing that. And it's not just about the specific subject part, let it be onco, let it be euro, let it be gastro. It's also about preparing for the general surgery where the NEET assess, the contents, they also help a little with regard to that. It's broad based from Sabiston, from Bailey, from everywhere. So, I think pretty much it prepares you for everything. So welcome to the field of oncosurgery, Dr. Sampada. I'm very
Thank
glad
you.
to welcome you as a junior colleague in the field. Any special people you want to thank for getting here? I'm sure you'll have a lot of people in your family, friend circle, among us, anywhere, wherever you want to. This is an opportunity for you to go live and tell them.
First of all, my mother and father, my parents, they have been extremely supportive. They belong from a non-medical background, so they may not know everything about it, but they have always been supportive of each and every decision of mine. My sister, who is my younger sister, but still behaves like she's the elder one and takes a lot of responsibility at home and also helping me. My would-be husband and fiance, we've been together since like 7 years, and he's been extremely supportive of my decision and also helps with the planning. My would-be in-laws and my grandmother, grandfather, they have been always supportive in every decision. Apart from family, my friends who have been helping me with the preparation and discussing things with me, my college, Grand Medical College and JJ group of hospitals, where I have been like I have studied right from holding the scalpel to making the abdominal incision. Everything I learned over there in last 10 years. So I'm extremely grateful to the Grand Medical College and the Department of General Surgery, where I got such inspiring seniors and mentors who have inspired me to achieve and come this far. Especially, I would like to mention a senior, Dr. Gurpreet Singh, who has just finished his oncosurgery from AIMS Delhi. He's giving exam this year. So he has been always been in inspiration since the days of MBBS. Like we are following the same path, like UG, PG, and MCS from the same institute now. So I was always in touch with him regarding the doubts. I have been asking you over the WhatsApp, sir, what to do about this. I used to ask him and trouble him a lot, but he never got irritated and always helped me. And like the way the Department of General Surgery is extremely helpful at JJ. And after that, the Department of Government Medical College Kolhapur, where I was doing SRship, they were also very happy and they were also very understanding about this exam. And they used to give me leave, like if I wanted to prepare, they were like, okay, you go and prepare. So they were very helpful. So it takes a village to like have this success. It's like that. So everyone has been extremely supportive, and definitely it's the Almighty who has been looking over me since like the time. So everyone has been very helpful, and I would like to thank Doc Tutorial for guiding me through this journey. And you, sir, you have been extremely patient, especially when you've taken the mock interview. You've been continuously speaking for like 6 hours without a break, and that was very inspiring. Like I'm sure you must be having a tiring day after the OT, but still you went on with us to teach us. So like all you also, sir, inspire me a lot, and I would like to thank you and Doc Tutorial team. And I'm just very happy right now to have this conversation with you.
Yeah, that's great. That's a great feeling, that we could all help you in this process is something, we aim to nurture young people who are getting into the field in whichever field it may be, it needs just a little bit of support, that inspiration and a little bit of guidance to get you along the right path. And rest of the things, actually, I keep telling the students, it's your work that, gets you where you are. We are just, guidelines along the path, the signposts, you can say that we point you in the right direction. We help you along the way. That is the main job that we do at Doc Tutorials as an entire team. And having faculty who are interested in teaching, that really goes a long way in inspiring many students, I would say. Because wherever I go, I find people who come and tell me, nowadays when I go to any conference, like yesterday I was in a conference And at that time somebody came and they told me that, sir, I was your student. When we have a lot of students, we may not remember everybody by name and face, but the fact that they come and tell us gives us a little bit of pride and honor that we were able to influence so many people along the right path and make them what they are today. And Dr. Gurpreet, I still remember, he used to be very persistent like you are, and he used to ask a lot of questions and everything. And it was a nice feeling being with him as well. The interview happened a couple of years ago, as you said. So that is very nice. So all the best, Dr. Sampada. Wishing you all success in your personal and your professional life. And please feel free to continue asking doubts. That is what asks us and keeps us on our toes, and makes us think a lot more. And all the best for your future.
Thank you so much, sir. Thank you so much.
Thank you.